This presentation is on the rising costs of healthcare. Healthcare costs have continued to rise over the years. Something must be done to help level out those rising costs. Currently, healthcare costs are increasing faster than inflation, according to Norton. One of the main issues that need to be addressed is the amount of administrators within the healthcare industry. According to David Cutler, one of the reasons that healthcare costs so much in America is because of how expensive the administrative costs are to run a healthcare system. When did this problem first appear? Alliance states that the problem is that the rising healthcare costs is not a new issue. According to Business NH magazine, healthcare spending in New Hampshire alone increased from $2.8 billion in 1990 to $10.4 billion in 2009. Annual premiums have increased by 3% just since 2016, according to Health Insurance Premiums and Increases 2017. If the cost of healthcare continues to rise, there can be consequences. Consequences can include the higher taxes, such as if healthcare spending is financed by taxes, then there could be an increase of about 70% by 2060. The gross domestic product can also decrease due to the increase of healthcare, and it can decrease by as much as 11%, according to the publication from Alliance. How are employers and employees affected? Employers are pressured to provide health insurance, but their budgets are already stretched so tight that they are struggling to do so, according to Lump 2006. Many employers have stopped offering employer-sponsored health care plans because of the cost. How much healthcare costs depends on where a person lives. According to NCSL employees, wages are not keeping up with the rising costs of healthcare plans. According to David Cutler, one of the reasons that healthcare costs so much in America is because of how expensive the administrative costs are to run a healthcare system. One plan is for management to cut down the amount of administrative positions. Management should be forced to look at every aspect of the organization to find ways to downsize. Communication. Employees should be asked to give their input on the whole situation. Leadership should also be involved in informing the employees about what is going on and what is going to happen during the evaluation. Showing them a breakdown of administrative costs that are billed for each patient during a hospital admission may get the attention of the employees. Like every issue, there are barriers and limitations. Whenever an idea of downsizing is presented, employees may not agree to help with the plan implementation if they think their job may be in jeopardy. The plan may end up being impractical. Barriers such as distractions may also happen. Another is a limitation, which is the cost of the plan. If the costs turn out to be higher than normally planned, that can be an issue. As it stands right now, healthcare expenditures are expected to equal about 18% of American gross domestic product, according to Locke 2009. In order for this whole process to work, there must be communication, some type of evaluation. In conclusion, whether there are political barriers or social barriers, this plan is worth a try. This plan is put in place for a reason, to help slow down the constant rising costs of healthcare. If this continues, then Americans will become more indebted to their medical costs. There are many social barriers such as employee cooperation and some management cooperation, but it must be done. This plan is for the benefit of all Americans and what healthcare costs will be in the future for their children and their children's children. Once this problem is solved, America will not have to worry about having to decide whether to get care for an ailment or illness or just try to live through it. This problem will not fix healthcare costs, but it will definitely help the issue at hand.